In a study recently published in the Journal of Cardiology that looked at a cross-sectional survey of adults in North America, it was determined only 6.8% of them had optimal cardiometabolic health. 6.8%, a stunning number. That means over 93% of the North American population has less than optimal cardiometabolic health. We've known for decades now that much of the North American lifestyle has been going off the rails. But these results paint a stark picture of how much work we really need to do if we want to have better health spans and quality of life as we age. And if you're someone who's in that 6.8%, you certainly want and need to stay there. You've learned some details about why metabolic health is important already. But it really is truly one of the biggest health challenges facing the U.S., and the consequences are deadly serious. The challenges facing a huge percentage of our population are tied to metabolic health. And the more we learn about it, the more we see that even for people who may not have progressed to serious challenges, their lack of metabolic health is still causing issues in their quality of life. Look at this chart, which represents some of the factors that affect metabolic health, as well as some of the factors affected by metabolic health. As you can see, exercise, diet, supplementation, relationships, rest, and stress management are all determinants that affect metabolic health. These determinants may not come as a surprise. You've probably heard them before. Of course, genetics affect our metabolic health, but exercise, diet, rest, relationships, these are all lifestyle factors you can influence for the better. Let's look at some of the things your metabolic health affects, or rather, factors that may reflect the state of your metabolic health. Blood sugar, blood pressure, lipid types and levels, and weight. When you effectively focus in the areas we talked about, exercise, mindful eating, strong relationships, stress management, and rest, they positively affect the outputs, like blood pressure, blood sugar, and weight. I know it isn't as easy to do as it is for me to say. And sometimes complicating factors make it even more difficult. When you don't see immediate results, or the results aren't as pronounced as you'd hoped, it can be discouraging. All or nothing thinking when trying to make significant lifestyle improvements is the enemy. Incremental improvements can have huge benefits. For example, one does not have to become a master athlete to reap the benefit of health span improvement. Moderate intensity exercise for only 30 minutes a day provides 70% of the benefits we are looking for. This is why I believe MetaPower can and will be such a powerful product system for so many people. It helps your health choices count a little extra. There are no silver bullets. You still have to make smart, healthy lifestyle decisions. But MetaPower is like maximizing and optimizing the effects of all those decisions, making their impact go further than they would otherwise.